Ever felt that, that twinge in your hip after maybe pushing it a bit too hard?
Hmm.
Now imagine that feeling getting worse, much worse. And it's not just a strain. Well, it's because the actual bone in your hip joint isn't getting enough blood and is starting to die.
Yeah, that sounds pretty serious.
It really is. And that's the condition we're diving into today, a vascular necrosis of the femoral head, AVNFH for short.
Right. And simply put, it's when the blood flow to the ball part of the hip joint gets messed up.
Disrupted.
Yeah, disrupted. And that can lead to the bone tissue breaking down and, the whole thing potentially collapsing.
It's definitely a complex issue, and all the medical jargon can feel a bit much sometimes.
Totally. So our goal with this deep dive is really to get to grips with AVNFH. We've pulled together medical research, conference findings, basically trying to understand what the science actually tells us about one specific way of treating it.
Think of this as like your fast track to getting informed about the condition and maybe a potentially really interesting therapy.
We're here to sort through the details, cut through the noise and bring you the key takeaways.
And what's really fascinating, I think, is how our understanding of AVNFH and how we might treat it has actually changed quite a bit over time.
Absolutely.
So today, we're zeroing in on one big question that keeps coming up in the research. Just how strong is the medical evidence for using hyperbaric oxygen therapy that's breathing pure oxygen in a pressurized room for treating this avascular necrosis of the femoral head?
Yeah, good question. And to really get why hyperbaric oxygen might even be considered, we first need to properly understand the condition itself.
Right, the background.
Exactly. And it might seem like a recent discovery, but the first descriptions of something that sounds a lot like AVNFH actually go way, way back.
Oh, really? How far back?
We're talking Alexander Monroe mentioning it in 1738. Then you have Jean Creveillier giving a detailed pathological look in 1842, and then Koenig provided a sort of more complete picture in 1888.
Wow. Okay, so doctors have been aware of this or something like it for centuries then.
Pretty much. It's been on the radar for a long time.
And the core problem, as you said, is this breakdown in blood flow.
That's the crux of it, yeah. The modern view, particularly highlighted by researchers like Myers, really focuses on problems with the intraosseous microcirculation.
Okay, fancy term. What's that mean in plain English?
It just means issues with the tiny, tiny blood vessels inside the bone itself.
Got it.
So this leads to vascular insufficiency, basically. Not enough blood getting through, and then prolonged ischemia.
Ischemia.
Lack of oxygen, right?
Exactly. The bone tissue gets starved of oxygen, and the end result of that is osteonecrosis, bone death.
Okay, so what causes this whole chain reaction, this blood flow problem?
Yeah.
Does it just happen, or are there specific triggers?
Well, it's interesting. There are quite a few different potential causes. It's quite varied.
Like what?
One well-known one is dysbaric osteonecrosis.
Dysbaric. Sounds pressure-related.
It is. It can affect people exposed to compressed gases, like divers experiencing decompression sickness, or even people working at really high altitudes.
And researchers like Jane and Jane explain how it could happen. Maybe gas bubbles forming in the blood or platelets clumping together, tiny fat particles blocking vessels, even the arteries narrowing.
Huh. So it's not just the pressure change itself, but how the body reacts to it.
Exactly. It's the physiological fallout.
Right.
But, dysbaric causes are only one part of the story.
Yes, sir.
Other big ones include using steroid medications for a long time. That's a major factor.
Right.
Also, injuries to the hip, like a bad fracture or dislocation, but maybe even less severe trauma sometimes. Damage from ionizing radiation is another one. And then there's what they call idiopathic osteonecrosis.
Idiopathic meaning they just don't know the cause.
Exactly, cause unknown, which is frustrating, obviously.
Yeah. And I think you mentioned before, sometimes underlying health conditions can play a role, too.
Yes, definitely. There's a list of conditions associated with a higher risk. Things like alcoholism, arteriosclerosis, hardening of the arteries, and also conditions like diabetes, sickle cell disease. Even rarer things like Cushing's syndrome or Gaucher's disease have been linked. It's quite a range.
So a condition with potentially many different starting points. How does it usually show up? What would someone actually notice first?
Well, the tricky thing is, early on, it can be completely asymptomatic.
No symptoms at all.
None. But as it progresses, the most common thing is pain, usually felt in the hip or sometimes radiating to the groin area.
Okay.
And in later stages, it can actually lead to a spontaneous fracture of the femoral head itself.
Wow. Just breaks.
Yeah. which is, obviously a very serious event.
And what's the outlook generally? If someone gets diagnosed, what typically happens?
Unfortunately, AVNFH tends to get worse over time if it's not treated effectively. The pain usually increases, and you start to see definite changes on X-rays and MRIs.
Right.
The big worry is the collapse of the femoral head. Some research, like from Ito and colleagues,
Yeah.
suggests that happens in something like 85% of cases eventually.
85%. That's huge.
It is. And once it collapses, that often leads to secondary osteoarthritis developing in the hip joint.
And how quickly does this tend to happen?
The typical time frame from symptoms starting to these more advanced stages is often around 2 to 3 years.
That's quite fast, actually.
It can be, yeah, which is why early diagnosis and treatment are so important.
Okay, so when doctors do treat it, what are they actually trying to achieve? What are the main goals?
Well, the main aims, as researchers like Glimcher and Kanzora laid out, are really about, first, trying to keep the ball part of the joint, the femoral head, round, preserve its shape.
Makes sense.
Second, encourage the body to clear away the dead bone tissue. Third, help new living bone grow in its place. And ultimately, just maintain the structural integrity of the whole hip joint so it can keep working properly.
Right. Trying to salvage the joint and keep it functional. And what are the sort of standard ways doctors have tried to do this traditionally?
The established treatments include things like core decompression.
What's that involve?
That's where they drill a channel into the bone to try and relieve the pressure inside and hopefully improve blood flow.
Okay.
There's also bone grafting, where they transplant healthy bone tissue into the damaged area. Stem cell therapies are also being used, trying to regenerate the tissue. And then there are various hybrid approaches, combining techniques, as described by folks like Mont and colleagues.
So those are the kind of baseline treatments that this hyperbaric oxygen idea is being compared against or maybe used alongside?
Exactly. That's the context.
Okay, so that gives us a really good grounding in AVNFH itself. Now, let's get into the hyperbaric oxygen therapy, or HBO. Why would breathing oxygen in a pressurized chamber help with this bone condition? What's the thinking behind it?
Right, the rationale. Well, there are basically 3 main ways HBO is thought to help here.
Okay.
First, and maybe most obviously, it's about boosting oxygen levels directly in that damaged bone tissue.
How does that work?
By breathing pure oxygen under pressure, you dissolve a whole lot more oxygen into your blood plasma, way more than usual. So this superoxygenated blood reaches the ischemic bone, the oxygen-starved area. And the hope is it can help reduce swelling or edema and also stimulate angiogenesis.
Osteogenesis, new blood vessel growth.
Exactly. Work by Nylander and others showed this. It's like trying to give that struggling tissue the critical resource, its missing oxygen, and help it build new supply lines.
Okay, so flooding the area with oxygen to kickstart healing and maybe grow new vessels. And there was a third point.
Yes. This one's maybe a bit less intuitive. It relates to pressure and circulation within the bone itself.
How so?
Research by Hungerford pointed out that the high oxygen levels can actually cause some temporary vasoconstriction, a narrowing of the blood vessels.
Wait, narrowing? Wouldn't that reduce blood flow? That sounds bad.
You'd think so.
Yeah.
But paradoxically, in this situation, it can actually help quickly reduce the edema, the swelling, and lower the really high pressure that often builds up inside the bone in AVNFH.
Ah, okay. So it reduces the damaging internal pressure.
Exactly. And by lowering that pressure, it can improve the venous drainage, getting fluids out, and ultimately improve the microcirculation overall in the femoral head.
Huh. Interesting. So it's not just about shoving oxygen in, it's also affecting the pressure dynamics.
It's multifaceted, more oxygen supply, supporting cell function, and improving the circulatory environment by reducing that harmful pressure.
Okay, that sounds like a pretty solid scientific basis for why it might work. So let's turn to the actual evidence. What does the research show? How has this unfolded over the years?
Well, the earliest hints came quite a while back. In 1969, there was a study by Bass and colleagues. They looked back at, I think it was 12 patients with early-stage AVN.
Pretty small group.
Very small. They gave them daily HBO for like 100 days, a long time. And they basically looked at whether follow-up MRI scans looked normal. They did report a significantly higher success rate in the HBO group compared to controls.
So some early positive signs.
Yeah, they concluded it seemed effective for early AVN. But again, tiny study, retrospective, you take it with a grain of salt. Encouraging, but needs way more investigation.
Right, baby steps. what came next? Did people start combining it with other things?
It did. Later on, particularly in the early 2000s, you saw studies looking at these combination therapies.
Like mixing HBO with...
With things like ESWT, that's extracorporeal shockwave therapy, and sometimes a drug called alendronate, which is used for bone loss. Researchers like Race, Wong, Su, they published studies, mostly looking back at patient results.
Okay.
Often focusing on specific situations like femoral head necrosis that happened after SARS infections or just general causes. And they did show some, promising short-term results. Seems like it might slow down the bone damage progression. But the researchers themselves were quick to point out these were often small groups, retrospective, and we really needed longer-term follow-up to know if the benefits lasted. So the idea was there may be combining treatments is the way to go, but the proof wasn't solid yet.
Okay, so combining therapies was on the table. But what about more rigorous trials, like randomized controlled trials, the gold standard?
Yeah, that was the next crucial step, and a big one came in 2010 from Camporese and colleagues. This was a proper double-blind, randomized controlled study.
Okay, that sounds more robust.
It was. They looked at 20 patients, specifically with stage 2 AVN, and they carefully measured things like pain scores, hip stability, range of motion.
And what did they find?
They found significant improvements in pain levels and a noticeable increase in range of motion for the patients got the hyperbaric oxygen compared to the placebo or control group.
Ah, okay. So a well-designed trial showing actual benefits, that definitely adds weight.
It really does. That kind of evidence starts to make people sit up and take notice.
Were there other studies looking at combinations, maybe with surgery?
Yes, building on that combination idea. In 2013, Davici and others did a retrospective study looking back at records again, suggesting that if you did core decompression, that standard surgical drilling procedure, and then followed it up with hyperbaric oxygen therapy, the results seemed to be better than just doing one or the other. They called it the synergistic effect.
Synergistic, meaning 1 + 1 equals more than 2.
Kind of, yeah. The combination seemed more powerful than just adding the individual benefits together. So maybe HBO could actually boost the results of surgery.
That's a really interesting angle, making existing treatments work better. What about focusing specifically on those early stages, stage I and II, before the bone actually collapses?
Good question. Several studies zoomed in on that. In 2015, Curran and colleagues published a retrospective study looking at 78 hips. These patients got a lot of HBO sessions, 100 actually.
Wow, that's a lot.
It is. And their findings suggested that this intensive HBO treatment was pretty effective at preserving the hip joint in those early stages, I and II.
Okay.
Then, a year later, in 2016, Aljanovich and colleagues published a detailed case study. They suggested that using ultrasound for early diagnosis, combined with HBO, might even help some patients avoid needing a total hip replacement down the line.
So the theme seems to be emerging. Maybe the earlier you intervene with HBO, the better the chance of success.
That's certainly what the evidence seemed to be pointing towards.
Okay, so we've got individual studies, some randomized, some looking back. What about the bigger picture? Those studies that try to synthesize all the evidence, like reviews and meta-analyses.
Yeah, those are super important for seeing the overall trend. And 2017 was actually a big year for those.
Oh, yeah. What came out?
Well, Goons and Actis did a review. They concluded HBO looked effective across different outcome measures and disease stages, but they also echoed that call for more high-quality, large randomized trials, standard caveat.
Right. Need more robust data.
But then, also in 2017, Lyon and colleagues published a meta-analysis. That's where they statistically combined results from multiple studies.
Okay, pooling the data.
Exactly. They looked at 9 studies, and their analysis showed a significantly higher clinical effect, basically. Better outcomes in the groups that got HBO. The odds ratio was 4.95.
Whoa, nearly 5 times better odds of a good clinical outcome.
Yeah, and it was statistically significant. That's a pretty strong signal from combining the existing data.
That is compelling. Any other big reviews around that time?
Yes. Camporese's group published another review that year, reporting a really high success rate. They cited 81% at a 7-year follow-up for HBO patients reporting less pain compared to just 17% in the control groups they looked at.
81% in Fatianpin, 17%. That's a massive difference.
Huge difference. And maybe most importantly, in 2017, there was the 10th European Consensus Conference on Hyperbaric Medicine.
Okay, experts getting together, what did they say?
Their consensus recommendation was that HBO could be considered for the initial stages of AVNFH. They gave it a type 2 recommendation, with level B evidence.
Which means
Basically good evidence, but maybe not absolutely slam dunk top-tier randomized trial evidence for every single aspect yet, but definitely strong enough to recommend considering it.
did they suggest how to use it?
Yes, they propose specific parameters. Daily sessions,
Sure.
at least 60 minutes, at 2.5 atmospheres absolute pressure, that's the ATA, using 100% oxygen, for maybe 4 to 5 weeks per cycle.
Okay, quite specific.
And crucially, they emphasized it shouldn't be seen as a standalone cure, but used as part of a broader, multidisciplinary treatment plan.
Right, integrating it with other care. So a growing consensus, at least among European experts. Did the research continue after 2017?
Oh yeah, definitely. The momentum continued. In 2020, Chandranu and colleagues did an observational study. They followed patients getting HBO for early AVNFH and found it didn't seem to negatively affect their quality of life and was generally well tolerated by patients.
That's important too, patient experience.
Absolutely. Then in 2021, Paderno's group published another meta-analysis.
Another one, what did this one find?
It basically confirmed the previous findings. Significant clinical improvement with HBO, this time with an odds ratio of 3.84. Still very positive.
So the meta-analyses keep reinforcing the benefit. What about more recent specific studies, comparing it to other things?
Yes, we've seen more of that too. In 2021, SAUHMA et al. Published a case series just describing outcomes in a group of patients showing satisfactory results and low complication rates for AVN that hadn't collapsed yet, specifically Steinberg stages 2 and 2.
Okay, more support for early intervention.
And also in 2021, Mulgamis and colleagues did a retrospective study that came up with a really interesting suggestion.
Oh, what's that?
They suggested that for non-traumatic AVN before collapse, HBO might actually be as effective as core decompression surgery.
Really? As effective as the surgery?
That's what their data suggested, which opens up the possibility of HBO being a non-surgical alternative for some patients in that group.
Wow, okay. That's potentially significant.
And then just last year, 2022, Bosgert et al. Found that if you combine HBO with core decompression, the improvement seems to be better than using HBO on its own.
Back to that synergy idea again.
Exactly. So it really feels like the evidence pile is getting bigger and more consistent, especially for early stages, and maybe pointing towards combination therapy being particularly effective.
It certainly seems that way. And how are they actually measuring success in these studies? What do they look for?
It's usually a mix of things. There are clinical assessments, the doctor checking pain levels, how well the hip moves function.
Yeah.
Then they use sequential imaging.
The X-rays.
X-rays, yes, to see structural changes over time, but MRI, magnetic resonance imaging, is really key.
Why MRI?
It's just much more sensitive for looking at the health of the bone tissue itself, detecting those early changes, the edema, the necrosis. And a really positive sign they look for on follow-up MRIs is reossification.
Reossification, new bone forming.
Exactly. Seeing evidence that healthy bone is starting to grow back in the area that was damaged. That's a very good sign.
Okay. So we've tracked this research journey, early hints, combination ideas, stronger trials, meta-analyses, all pointing generally positive, especially early on. How has all this mounting evidence actually influenced the kind of official medical stance on using HBO for AVNFH?
Yeah, that's the crucial step, isn't it?
Yeah.
Translating research into accepted practice. And it's interesting because back in October 2011, the Undersea and Hyperbaric Medical Society, the UHMS, which is a major international body in this field,
Right.
they explicitly did not include AVNFH on their list of accepted indications for hyperbaric oxygen therapy.
So 10, 12 years ago, it wasn't officially endorsed by them.
Correct, which really underscores that the bar is set high. You need a lot of consistent, strong evidence before these official bodies change their guidelines. It highlights how that acceptance process evolves.
It takes time for the evidence to build and consensus to form. Has that stance shifted at all more recently?
Yes, and this is quite significant. Just last year, in October 2023, SAUHMA, that's the Southern African Underwater and Hyperbaric Medical Association,
Okay.
they unanimously voted to accept avascular necrosis of the femoral head as an accepted indication for HBO therapy.
So a major regional body has now formally accepted it.
Exactly. It's a landmark acceptance within the hyperbaric community. And they even proposed a specific treatment protocol to go with it.
The same one the European consensus suggested.
Very similar. 100% oxygen at 2.5 ATA for 90 minutes per session for a total of 30 sessions.
And how would they measure success?
They proposed looking for radiological evidence, seeing increased bone density on scans, and also, of course, symptomatic improvement reported by the patient.
That feels like a really big step forward in terms of formal recognition.
It absolutely is. It signals a growing confidence backed by the accumulated evidence within at least parts of the specialized medical community.
So given all this progress, but maybe still some lingering questions,
Yeah.
what do researchers say still needs to be done? Where does the research need to go next?
Well, that meta-analysis by Paderno and colleagues in 2021 actually gave some really clear suggestions for future trials.
Oh yeah, like what?
They really emphasized the need for more standardization across studies, making things more consistent so we can compare apples to apples,
Makes sense. Standardization in what areas?
Several key things. First, patient selection criteria, making sure studies clearly define who is included based on age, maybe race, BMI, their medical history, the exact stage of AVNFH, using a consistent system like FICAT or Steinberg,
Right.
whether it's one hip or both. If they use walking aids, their smoking status, all these factors need to be documented consistently.
Okay, be really clear about who's being studied. What else?
Second, the HPO treatment protocols themselves need standardizing. What's the optimal pressure? 2.5 ATA, something else? How long should each session be? 90 minutes, 60. And crucially, what's the right number of sessions? We saw studies using 30, others using 100. We need more clarity on the ideal dose.
Right, finding the sweet spot for the treatment itself.
Exactly. Then third, follow-up protocols. How often are patients checked? What tests are done at each checkup? Needs to be consistent. Fourth, how the data is presented. They suggested focusing on the number of hips treated, not just patients, since one person could have 2 affected hips treated differently.
Ugh, that's a subtle but important detail for analysis.
It is. And finally, they stressed the need for genuine long-term follow-up in future studies. We need to know if the benefits seen at 1 or 2 years actually hold up 5, 10 years down the line.
So basically, more rigor, more consistency, longer time frames. It's about building an even more robust evidence base.
Precisely. It's about refining our understanding and ensuring future research is as informative as possible.
Which, brings us back to that Arthur C. Clarke quote we mentioned. Any sufficiently advanced technology is indistinguishable from magic. Thinking about using pressurized oxygen to heal bone deep inside the hip. It can feel a bit like that, can it? Like something almost magical.
It can have that feel. But as we've unpacked today, it's actually grounded in, understandable physiological mechanisms and a steadily growing body of scientific investigation.
So that question we started with, are we there yet with HBO for AVNFH? Have we reached the point where it's fully understood and optimally used?
Well, that SAUHMA acceptance is huge, no doubt. And the research trends are largely positive. But those calls for more standardized, long-term trials, they suggest we're still on the journey. All right. Still refining, still learning exactly how and when to use it best. It's an ongoing process.
Okay, so let's try and wrap up this deep dive. We've established that avascular necrosis of the femoral head, AVNFH, is a really serious condition, bone dying in the hip due to lost blood supply.
Right, potentially leading to joint collapse and significant disability.
And hyperbaric oxygen therapy seems to offer a genuinely promising approach. It works by boosting oxygen to the damaged bone.
Supporting the bone's repair cells and improving the overall circulatory environment in there.
And the evidence, while it's definitely still evolving, it increasingly points towards real benefits, especially if it's used in the earlier stages, maybe stage 1 or 2, and perhaps alongside other treatments like core decompression.
And that recent formal acceptance by SAUHMA is a really important milestone, showing growing recognition within the medical field.
Absolutely. So for you listening, hopefully this deep dive has given you a comprehensive look at the current state of play, the medical understanding of AVNFH, and the evidence behind HBO as a potential therapy. It really shows that scientific journey, doesn't it? Understanding a problem and rigorously testing a potential solution.
It does. It's a great example of how medical knowledge advances.
And, if you or maybe someone you know is dealing with ongoing hip pain or has actually been diagnosed with AVNFH, maybe this information is something to consider, something to potentially discuss further with your own doctors.
Definitely worth being informed about the options.
And just to leave you with a final thought, as we get better and better at understanding how the body responds to oxygen under pressure, this hyperbaric therapy, what other medical challenges might it help us tackle in the future, beyond just AVNFH?
That's a fascinating question. What other frontiers might hyperbaric medicine unlock as our knowledge deepens? Something to ponder.